Hello friends, today we will be discussing what is the difference between IUI, IVF and ICSI procedures. I am Dr. Neha Jadhav, IVF specialist practicing since last 10 years in Pimple Saudagar, Pune. So whenever a couple do not conceive naturally, they will go to an IVF specialist and that IVF specialist will evaluate both the couple, both the husband and the wife for the causes of infertility, and depending upon what is the cause, the IVF specialist will offer you what is required, IUI, IVF or ICSI. So let us see first what is IUI. IUI means Intrauterine Insemination. In this, the procedure will start from day 2 of your periods, where the woman is called and her follicles are monitored. What probability is there, how many eggs are going to be produced in this cycle. She will be started on certain medications like letrozole or clomiphene citrate for 5 days, and they will be called back from day 9 or day 10 for the ovulation monitoring. So whenever the follicle reaches a certain good size of 18 to 20 mm and with a good endometrial lining, the IVF specialist will give one injection which is called as trigger. Post that injection, ovulation is expected to happen within 36 to 48 hours. So the IUI of that couple will be planned 36 to 48 hours post that trigger injection. Now in that IUI, the husband's semen sample will be taken. It will be washed to clear all the unwanted pus cells, debris, and a clean, good sample is inserted into a good media which will help the sperms to increase their motility and increases the chances of pregnancy. Now whenever we plan a natural cycle, the sperms are generally deposited in the vagina. But what will IUI help us is near the mouth of the cervix. But what we do in IUI is we take this semen sample and try to insert it near the fundus so that the vagina, the cervix and much part of the uterus is bypassed and the sperms are deposited near where the egg is released. Now the success of IUI, it all depends on multiple factors, but on an average the success rate of IUI is around 15 to 20%. Now let us see what is IVF or in vitro fertilization. In this, we call the woman on day 2 of her periods and we start her on injections, which are some hormonal injections which help to increase the number of eggs and the quality of eggs. These injections are given for almost 8 to 10 days, and whenever the ovum or the egg reaches a size of 16 to 18 mm, again a trigger injection is given. Now, after the trigger injection, the eggs are going to get ruptured inside the abdomen. So it will rupture after 36 hours so that the eggs should not get lost. So we plan her egg pickup or the ovum pickup before 36 hours of the injection. Now this ovum pickup procedure is a small OT procedure in which we admit the patient, we give a small general anesthesia or sedation, and under anesthesia, her eggs are retrieved under USG guidance. So whatever eggs are produced in one cycle, we store them for the subsequent use of next cycles. After the ovum pickup procedure, we take the husband's semen sample and whatever best quality sperms are there, they are left in a petri dish. In IVF cycle, we take the retrieved egg and we leave the sperms in that petri dish so that the sperms can naturally fertilize the egg. For one egg, we approximately put 25 to 30,000 sperms in one petri dish so that they can naturally fertilize the egg and wait for a day for the fertilization to occur. So whatever was going to happen inside the body, which we call it as in vivo, exactly same replica we do it in lab, which is known as in vitro fertilization, and hence the name IVF. Next day, your embryologist or the IVF specialist will see how many eggs are being fertilized. So we do this procedure in those couples where the semen count at least should be more than 5 millions per ml. Now in those male partners where the semen quantity is less than 5 millions, they have less of sperm motility and the morphology is also not good. In them we cannot advise IVF. So in those couple we have to go one step ahead and advise them ICSI, which is known as Intracytoplasmic Sperm Injection. We do this procedure because when the semen quality is not good, and suppose if we got good quality of eggs and the sperms do not manage to fertilize the egg, then everything of the cycle goes waste. So in ICSI procedure, we go one step ahead of IVF, where we hold the egg with a micro manipulator and one sperm is directly injected into the substance of the egg, so that for one egg, one sperm is more than enough. Now, in ICSI procedure, at least we are sure that all the eggs which we have retrieved are all fertilized, which doesn't happen in IVF. Even after ICSI, after 24 hours, we come to know how many embryos are formed and how many of them are of good quality. Now, if everything goes smoothly, we insert these embryos depending upon day 3 of embryo or day 5 of embryo inside the uterine cavity, which procedure is called as embryo transfer. After any of this procedure, let it be IUI, IVF or ICSI, we start the patient on progesterone support, we start on blood thinners and some hormonal support, and ask the patient to do her beta HCG levels after 14 days or 2 weeks. Now, success of IVF or ICSI, that is also dependent of multiple factors and it varies from center to center. So whenever a couple goes for an IVF treatment, the IVF specialist needs to evaluate both the partners in a couple. And depending upon that, what is the cause of your infertility, your IVF specialist will advise what is going to help you or benefit you, either IUI, IVF or ICSI. So if you have any doubts or questions related to this, please let us know in the comment box or contact us on the number given below.